Did you know that you're part of an ongoing story, a story that's been unfolding for millennia? It's the story of epidemiology, the study of how diseases spread. Epidemiology. It's a word that might seem daunting at first, but it's actually quite simple when you break it down. Epi, a Greek word meaning upon, demos meaning people, and ology meaning the study of. Combined, they form epidemiology, the study of what is upon the people. In other words, it's the science of understanding how diseases spread among populations. But why is epidemiology important? Well, imagine a world where we didn't understand how diseases spread. Without this knowledge, we'd be powerless against outbreaks, pandemics, and epidemics. We wouldn't know how to protect ourselves, how to contain the spread, or even how to treat the disease effectively. Epidemiology has played a vital role in shaping our lives and societies throughout history. Take smallpox, for instance. This deadly disease ravaged populations for centuries before the advent of epidemiology. Once we understood how smallpox spread, we were able to develop a vaccine, implement public health measures, and ultimately eradicate the disease. Fast forward to the 21st century, and we find ourselves in the midst of another pandemic, COVID-19. It's the understanding of epidemiology that has guided our response to this global crisis. It has informed our strategies for testing, contact tracing, social distancing, and vaccine distribution. But epidemiology isn't just about battling diseases, it's also about prevention. It helps us identify risk factors for disease and targets for preventive healthcare. It's the compass that guides us to healthier societies, pointing out the pitfalls and showing us the path to wellness. In a nutshell, epidemiology is the unsung hero in our fight against diseases. It's the detective that uncovers the secrets of diseases, the strategist that plans our defense, and the guardian that protects us from the unseen threats. So, buckle up as we delve into the fascinating world of epidemiology. Every day, an invisible war rages around us, a war between humans and pathogens. It's a battle fought on a microscopic scale, yet its implications are colossal, touching every aspect of our lives. Now let's imagine this war as a chessboard. On one side, we have the pathogens, invisible invaders that cause diseases. They're crafty, always coming up with new strategies to invade our bodies. They're like the rogues of our story, constantly evolving, adapting, and trying to outsmart our defenses. On the other side, we have the humans, but we're not defenseless. We have an army of our own, ready to counterattack. And who leads this army? You might think it's the doctors and nurses, and you'd be partly right. But there's another group of warriors in this war, often working behind the scenes. They're the epidemiologists, our unsung heroes. Epidemiologists are like the intelligence officers in our war against diseases. Their role is to track and understand how diseases spread. They study patterns, collect data, and analyze it to predict where the enemy might strike next. They're the detectives of the health world, always on the hunt for clues to unravel the mysteries of disease transmission. Understanding disease transmission is crucial because it helps us anticipate and prevent outbreaks. It's like knowing the enemy's battle plan. If we know how a disease spreads, we can devise strategies to block its path. We can protect vulnerable populations, control the spread, and ultimately save lives. So, while we may not see the invisible war around us, we feel its impact. And while we may not see the work of epidemiologists, we benefit from it every day. They help us understand our enemy and equip us to fight it. In the end, it's not just a war against diseases. It's a war for our health, our well-being, and our future. In the fight against diseases, epidemiologists are our unsung heroes. They are the watchful guardians, the vigilant protectors, the silent warriors in the invisible war that rages every day. Like any good detective, an epidemiologist has an arsenal of tools at their disposal. Imagine our world as a giant jigsaw puzzle, with each piece representing a tiny clue about the spread of diseases. The tools of epidemiology are the magnifying glass and tweezers that help us pick up these pieces and put them together. One of the most critical tools in an epidemiologist's toolkit is statistical analysis. It's like the compass guiding our epidemiologist through a thick forest of numbers and data. By applying various statistical models, they can identify patterns and correlations in the spread of diseases. For example, they might notice that a particular disease is more prevalent in certain geographical locations or among specific age groups. Another vital tool is contact tracing, which works like the breadcrumbs left by Hansel and Gretel. When a person tests positive for a contagious disease, epidemiologists trace their steps back in time to identify who they've been in contact with. This allows them to warn these individuals, test them, and if necessary, ask them to self-isolate to prevent further spread of the disease. Epidemiologists also employ disease surveillance systems akin to the watchtowers in a castle. These systems monitor the health of populations, looking out for early signs of disease outbreaks. This can include anything from tracking hospital admissions to monitoring Google search trends for symptoms. And let's not forget the role of laboratory testing. It's the microscope that lets our epidemiologists see the invisible enemy. Whether it's identifying the pathogen causing the disease or testing for antibodies in recovered patients, lab tests provide invaluable information in battling outbreaks. These tools don't just help in understanding the spread of diseases, but also informing strategies to control them. By identifying who is most at risk, where the disease is spreading fastest, and how effective different interventions are, these tools guide policymakers in making informed decisions on public health measures. With these tools, epidemiologists can unravel the mysteries of disease outbreaks. In epidemiology, prevention is better than cure. This statement is not just a catchy phrase, it's the backbone of the entire field. It's a call to arms, a mantra that underscores the most effective strategy in disease control: stopping an illness before it starts. Delving into the realm of prevention, we find two key players: vaccines and public health measures. Vaccines are like covert agents, training our immune system to recognize and combat specific invaders. When we get vaccinated, our body learns how to fight off a disease without having to suffer through it first. It's a bit like a fire drill, preparing us for an emergency we hope will never come. Now, imagine the power of vaccines on a global scale. When a majority of people are vaccinated against a particular disease, we achieve what's known as herd immunity. This is a protective shield that not only guards the vaccinated, but also those who can't get their shots due to medical reasons. It's like a collective force field, keeping diseases at bay. However, vaccines are just one part of the prevention puzzle. The other vital piece is public health measures. These measures include actions that we as a society can take to prevent disease spread. Think of hand washing, wearing masks, or maintaining social distancing during a pandemic. These simple actions, when adopted widely, can significantly curb the spread of diseases. Preventive measures also encompass broader initiatives like improving sanitation, providing clean drinking water, and ensuring access to healthcare. These efforts target the root causes of many diseases, offering a long-term, sustainable solution. In the world of epidemiology, we often find ourselves in a race against time, trying to outpace the spread of diseases. And in this race, prevention is our most reliable ally. It's a strategy that not only saves lives, but also reduces the burden on our healthcare systems. So, as we navigate the complex world of disease control, let's not forget the power of prevention. Because at the end of the day, prevention is our most powerful weapon in the fight against diseases. As we look to the future, the role of epidemiology is more important than ever. This is a field that's always evolving, always adapting, and it's facing some pretty hefty challenges. One of these challenges is the emergence of new diseases. Every year, we see the rise of novel illnesses that we've never encountered before. These diseases can be caused by a variety of factors, from climate change to increased global travel, and it's the job of epidemiologists to identify, understand, and manage these health threats. It's like a high-stakes game of whack-a-mole, where the stakes are human lives. Another major issue is antibiotic resistance. For decades, we've relied on antibiotics to fight off infections. But these microscopic enemies are learning our strategies. They're evolving to resist our drugs, leading to superbugs that are harder and harder to kill. This is a ticking time bomb, and epidemiologists are on the front lines, trying to defuse it. But it's not all doom and gloom. The future of epidemiology is also filled with promise. The ongoing research in this field is astounding. We're developing new strategies, new technologies, and new ways of thinking that could revolutionize how we deal with disease. We're not just playing defense anymore, we're going on the offensive. For instance, the rise of digital health technologies is giving us more data than ever before. This data can help us predict outbreaks, track disease spread, and even develop personalized treatment plans. Meanwhile, advances in genomics are allowing us to understand diseases on a molecular level, opening the door to targeted therapies and even potential cures. But the future of epidemiology isn't just about the scientists in lab coats, it's about all of us. We all have a role to play in this story, whether it's washing our hands to prevent the spread of disease, getting vaccinated to protect ourselves and our communities, or supporting public health initiatives in our local areas. In the ongoing story of epidemiology, we all have a role to play. So, here's a question for you. How can we as individuals contribute to this field? Share your thoughts in the comments below.